Dear listeners, to prevent diabetes, obesity, reducing total energy intake, and fat were considered in part 1 of this series. This video is Diabetes Prevention Part 2. Cholesterol. Cholesterol is essential for the body for maintenance of healthy cell walls, production of hormones and vitamin D, and to perform various other important functions. Body needs 800 milligrams per day of cholesterol. All the body needs are supplied by the liver. There is no need of supply of cholesterol through foods. Cholesterol-rich foods are red meats, eggs. Per egg yolk 200 milligrams of cholesterol, and saturated fats 1.5 grams, and dairy products. Most foods that are rich in cholesterol are also high in saturated fatty acids, and these increase risk for cardiovascular disease, that is CVD. Foods that have no cholesterol are fruits, vegetables, grains, seeds, nuts, beans, peas, and lentils. Dear listeners, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions, available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Now, back to discussion on diabetes prevention. Foods that lower bad low-density lipoprotein cholesterol. 1. Oats, barley, whole grains, they have more fibers. 2. Beans, rich in fiber. 3. Eggplant, that is brinjal, and okra, that is lady's finger, tomatoes, non-starchy vegetables such as leafy greens, broccoli, and cauliflower. All nuts including peanuts. Vegetable oils like canola, sunflower or coconut oil, sesame oil, groundnut oil, in place of animal fats like butter and lard. Apples, bananas, grapes, strawberries, papaya, pineapple, citrus and other fruits rich in soluble fiber, that is pectin. 7. Soya beans. 8. Fatty fish has LDL lowering omega-3 fats which reduce triglycerides in blood and helps to prevent the onset of abnormal rhythms in the heart, that is arrhythmias. Meat, unlike fish, has bad LDL boosting saturated fats. Nowadays, getting fish without chemical preservatives or getting fish from unpolluted waters is difficult. If at all cholesterol containing foods are to be included in the diet, keep it to a minimum. Cholesterol should be limited to less than 250 mg per day, less if dyslipidemia, that is enhanced blood levels of LDL cholesterol and triglycerides, is present. Carbohydrates. Carbohydrates should account for more than 55% of total energy intake, preferably in the form of foods rich in soluble fiber. Example, unpolished wheat, unpolished rice and other cereals, pulses, root and leafy vegetables and fruits. Some have a mistaken notion that wheat is better than rice. Wheat gives 350 calories per 100 gram of dry weight and rice 347 calories per 100 gram. It's a negligible difference. Their glycemic index, see below, are also same. Avoid foods that are bad carbohydrates, that is high in sugar with little fiber or nutrients. Example, white bread and pastries, pasta from white flour, fruit juices, and processed foods with sugar or high fructose corn syrup, French fries, packaged snacks, and processed baked goods like pastries. Sugary drinks, especially fizzy glucose solutions that are supposed to give energy, should be avoided. The present recommendation, which seems reasonable but is not based on evidence, is to limit added sucrose, that is cane sugar, beet sugar, and honey, to less than 50 gram per day, that is 10 teaspoons. Many fad diets, such as the glycemic index based diet, paleo, or keto diets, may help you lose weight. There is little research, however, about the long term benefits of these diets or their benefit in preventing diabetes. Protein. Protein should contribute to 10 to 15% of total energy. Percentage of protein in foods per 100 gram. Animal based foods, meat 26%, chicken 27%, egg weighs 50 to 70 gram, 13 grams per 100 gram. Fish 13 to 20%, milk 3 to 3.4 gram per 100 ml. In vegetables 3 grams per 100 gram, fruits 0.3%, pulses 20 to 30%, soya bean 40%, cereals in general 10%. Animal proteins are complete proteins. That means they contain all the essential amino acids needed. Pulses are rich sources of proteins. However, plant proteins are incomplete sources of protein. That is, they do not have all essential amino acids in one source. This deficiency can easily be compensated by taking a variety of pulses and vegetables. Diets that rely mostly on plants for protein have been linked to a lower risk of stroke, heart disease, and early death than animal protein. Plant-based protein provides plenty of nutrients, fiber, and antioxidants that can improve health. The phytochemicals present in plants are flavonoids, phenolic acids, isoflavones, curcumin, isocyanates, and carotenoid. They may help to prevent cancer. Sodium intake should be less than 6 grams per day, that is slightly more than 1 teaspoon, and less in patients with hypertension. Alcohol. Countless scientific studies have espoused the idea that a glass of red wine a day can be good for the heart. Moderate drinking may safeguard people against heart disease, but the potential to develop diseases, driving accidents, self-harm, cancer, about 5% of cancers are linked to alcohol, and other diseases, offsets these potential benefits. Alcohol led to 2.8 million deaths in 2016. It was the leading risk factor for diseases worldwide. The more people drink, the higher their risk of alcohol-related health problems. The safest level of drinking is no alcohol at all. This zero level is in conflict with most health guidelines which espouse health benefits associated with consuming up to 2 drinks per day. Present so-called recommendations. Alcohol contains 7 calories per gram, that is 29 joules per gram. Beers and wines in particular can be fattening. Intake should not exceed 3 units, that is 30 grams per day in men, and 2 units, that is 20 grams per day in women, and should be further limited or avoided at all altogether in those with hypertension or obesity. Diabetic beers, low in sugar but strong in alcohol, and spirits with sugar-free mixers are especially likely to provoke hypoglycemia, that is, lower than normal blood sugar levels. Sucrose and aspartame. Moderate amount of sucrose are acceptable, see earlier, and non-caloric sweeteners such as aspartame have no adverse metabolic effects. Diabetic sweets and foods contain sorbitol or fructose instead of glucose. They may cause diarrhea in some. Glycemic index. Glycemic index is the rapidity with which they cause hyperglycemia, that is, increase in blood sugar levels. There is no difference in the glycemic index between wheat and rice. Foods with a low glycemic index include cereals and pulses, probably because of their high fiber and complex carbohydrate contents, while bread has a surprisingly high glycemic index. The glycemic index of many foods, such as potatoes and pasta, varies widely according to the method of cooking and even the shape of the pasta. And in real life situations, in various kinds of foods, has unpredictable effects on the overall postprandial, that is, after meals, glucose rise. Exercise. Increasing physical activity. Short-term exercise and improved physical fitness both increase insulin sensitivity, resulting in increased glucose uptake by muscles. This effect is independent of insulin and can enhance glucose uptake better than oral drugs. Exercise also improves muscle blood flow. Exercise decreases cardiovascular events. Exercise must therefore be encouraged in all diabetic patients, but the advice must be realistic, achievable, and safe. Brisk walking for 30 to 40 minutes every day is better physiologically than a hectic workout in the gym once or twice a week, and is within almost everyone's reach. Instead of quietly sitting in front of television, do simple body exercises while watching TV. By the way, exercise is a topic for an upcoming video. Watching TV instead of pursuing something more active increases the chances of developing diabetes by 20%. It also increases the risk of heart disease by 15% and early death chance by 13%. The more television people watch, the more likely they are to be overweight or obese. And this seems to be the explanation for the TV viewing diabetes link. The unhealthy diet patterns associated with TV watching, that is, uncontrolled eating of high calorie foods, may also explain some of this relationship. Potential hazards of exercise include hypoglycemia, that is, decreased blood sugar levels, in patients on sulfonylureas or insulin, which may be delayed by several hours, and sudden cardiac events. Hence, patients at risk must be examined by a doctor, should have an ECG with consideration for an exercise tolerance test and echocardiography, and appropriate treatment for ischemic heart disease or heart failure before starting exercise. Exercise remains beneficial and important in ischemic heart disease or heart failure cases, but should be built up gradually. Smoking. Smoking is at least as common among diabetic patients as in the general population. Smoking greatly amplifies macrovascular, that is, larger blood vessel risk in diabetic subjects. 10-year mortality, mainly from myocardial infarction, is about 50% higher in diabetic smokers than in diabetic non-smokers, and twice as high as in non-diabetic non-smokers. Smoking may also accelerate the progression of nephropathy, that is kidney disease, and possibly retinopathy, that is retinal disease, eye disease. Many people living with diabetes, especially young women, continue to smoke as a means of keeping thin and because they fear gaining weight if they stop. Nicotine reduces fondness for sweet, energy dense foods and may also be mildly thermogenic, that is, increasing body temperature and hence burning up body calories. Weight gain after stopping smoking averages 3 kilograms, but about 20% of cases gain more than 6 kilograms. The risks of continuing to smoke are much greater than this degree of weight gain. Pharmacological support to overcome nicotine dependence, including the use of nicotine replacement antidepressants, example bupropion, nortriptyline, and other drugs, increases the chance of quitting by around 2 to 3 fold. Electronic cigarettes, e-cigarettes, are battery-powered devices with cartridges that contain nicotine, flavors, and other chemicals which are inhaled as a vapor. These are a popular substitute for smoking as they are cheaper, widely available, and probably less harmful than cigarette smoking. However, there are concerns about their long-term safety as clinical trials to ascertain safety have not been performed. There are also concerns that the sweet flavors and bright colors may encourage children to use the products and develop a nicotine addiction.